Thank you for joining us for today's webinar. And now I'll go ahead and get it turned over to our speaker.
Great. So thanks again, everyone, for attending today's session. As you can see, we're going to talk about how augmented intelligence solves the prior authorization related revenue bottleneck and the staffing shortage related issues that orthopedic practices are facing more than ever right now. So we'll get right into it. I'm Aakarsh, and I've been working at Infinix Healthcare for almost 5 years now. And what we do at Infinix Healthcare is build some very cutting edge technology backed by domain experts to solve some of the key challenges that revenue cycle management presents today. And I've been helping Infinix as a product manager in developing some of these products and technologies. So let's get right to it then. And I think it makes sense to start off by addressing some of these challenges that prior authorization presents to orthopedic practices across the country today. All of these challenges, in one way or another, not only impact both the top line and bottom line of providers, but really have a ripple effect into the patient experience, which makes it all the more impactful in terms of addressing such challenges. The first one and the second one, I can couple them together: significant administrative costs and staffing shortages. Prior authorization is, amongst other patient access tasks such as getting insurances verified, benefits, patient estimations. Prior authorization specifically is a highly manual task, and it is so because of a couple of reasons. One is it requires a lot more clinical reviews, a lot more administrative functions, and payers usually take an uncertain amount of time in getting back to you in terms of if anything additional is needed, or even just to grant the authorization. And there's expensive staff that is deployed by practices and providers to perform these manual functions, a lot of which comes at a very high opportunity cost, which is of patient care or other more impactful functions. Staff can be doing prior authorizations, talking to payers on hold for 45 minutes in one go and not doing anything productive, really. So there's significant administrative costs, as the slide mentions. There's also long turnaround times and the uncertainty regarding when the payer is going to approve the auth, which then means there's almost a full-time commitment of a staff to chase down an authorization, but not only initiate the authorization. So once it's with the payer, you have to manage, the timelines you're working with respect to when the patient is supposed to come in for the procedure and make sure the auth is obtained by then. And this involves constantly following up with payers if they haven't granted the authorization already. So that is the operational challenges here, but there's a direct revenue and bottom line impact when it comes to claim denials. So one of the main challenges with respect to prior authorizations is really not even knowing what requires a prior authorization, or what are the clinical guidelines associated with getting that prior authorization approved. And this can get very complicated sometimes, depending on the payer and depending on the type of procedure that you want authorized. And it can certainly lead to claim denials and then write-offs down the payment lifecycle. Payer requirements are constantly changing. You're not working with one entity. You're not just working with a CMS, for example. You're working with a myriad of different commercial payers, all of whom have their own set of guidelines, which are relatively obscure. So these are, in essence, some of the high-level challenges that we see providers face when it comes to prior authorizations. we've looked at the challenges. Now let's get to, the core, the crux of the solution that we really want to hit on today, which is this concept of augmented intelligence. So the slide here talks about the concept of artificial intelligence, right? Over the last 5 to 7 years, artificial intelligence really is gaining traction and popularity, if not, in reality, at least in terms of buzzwords that you see around there. But artificial intelligence really is the ability for a machine to perform tasks that typically require some level of human intelligence, right? The biggest form of artificial intelligence that is deployed to doing this is called machine learning. What we noticed when we tried to tackle all of these different problems in prior authorization, maybe 5 or 6 years ago, using artificial intelligence, we realized the complexity that is involved within healthcare functions. And even within administrative functions like prior authorization, there is the clinical decision making that really needs to leverage experience, domain knowledge, and of course, clinical expertise to make sure that the authorization is obtained and down the road, the claim doesn't get denied. This really comes to when the payer needs additional information on the patient's diagnosis. Maybe you have to answer a clinical survey based on the patient's diagnostic history and so on. So thinking hard about this problem, we came up with this concept of using augmented intelligence instead of artificial intelligence, where artificial intelligence really will be combined with clinical intelligence to get the best out from an AI potential point of view, and in terms of effective outputs in addressing those challenges talked about in the previous slide. So we'll talk a little bit more about what this, certain entities refer to it as a digital supermind is. As you can see, this is an interesting graph. It has human labor at one end, and on the two different axes of the graph, you have AI on one side and robotics, automation on the other side. Really combining all of these three, getting the best out of all of these three, takes us to this concept of digital labor, which is what we feel is the way the industry will move forward. Getting into specifics about augmented intelligence for prior authorizations, how does this help you? How does this help solve the prior authorization challenge more efficiently? And it uses this three-pronged approach, as referred to in the previous slide, where it combines automation, AI, with the prior authorization expertise that comes from specialists, from humans. So it enables a more intelligent decision-making by leveraging both humans and machines. Machines can be more intelligent in certain ways where you're looking at a lot of different data and you have to crunch it down. Machines can help with that. Machines can help with the automation of redundant, monotonous tasks. And then when it comes to the more clinical nuances, that's when prior authorization specialists or clinical specialists can add in and make sure that the AI is on the right track, and then chime in also to add to the work that the augmented intelligence so as to produces. Okay. What it should lead to is better and improved outcomes, reduction in costs associated with processes. And the other key advantage of the AI component here is that it's continuously learning and improving. The more it's kind of a network externality here, where the more people that use it, the more data that our machine learning models see, the better it gets. So at Infinix, the way we really tackle this augmented intelligence when it comes to prior authorization is by breaking up the prior authorization process into 3 or 4 different steps. And by doing so, we really bring out the best of this augmented intelligence model. When we first started looking at this challenge, we looked at prior authorization as just one linear process end to end, and it becomes very difficult to automate the entire process as one single process. But when you break it down into different processes, you can get a lot more efficient when it comes to using some of these technology capabilities. And then it adds up to the overall efficiency of the process. So the first thing we look at is determining whether an authorization is even required or not. Because that is one of the challenges that we mentioned on, I think it was the first slide, right? Just lack of uncertainty, lack of clarity in even knowing the guidelines associated with prior authorization, not just on what type of requests get approved, but also what type of requests even need prior authorizations. We've come across many instances in the past where providers, users, leverage what we like to call tribal knowledge in seeing that, hey, this type of service typically doesn't require prior authorization. So let's just go ahead with it, not a problem. But something changes with a specific payer, some guidelines change, and suddenly 3 months down the line, your claim gets denied for not having a prior authorization. So determination is a key step, sometimes overlooked, but definitely a critical step in the prior authorization process. It turns out that there's a lot of machine learning AI applications within the determination component. At Infinix, we've been able to build a proprietary machine learning model that actually can predict at a very high confidence if a certain transaction or an order requires prior authorization. We were fortunate that we had a business in prior authorization for a long time, across the nation, across geographies, through looking at different payers, different plans. So we leveraged all of that data, and that allowed us, with our fantastic data science team, to get very good at predicting what requires authorization, what doesn't require an authorization. Our models right now are almost 99% accurate in predicting that. The other thing is predicting turnaround times. Another challenge we talked about initially, which is, okay, now that we know something requires an authorization, step 2, as you see here, is initiation, right? You initiate with the payer. We also built a model that can predict how long after initiation a payer will take to respond to certain types of transactions. This can have many benefits, one of them being optimized scheduling, so that you're always confident that your authorization is obtained by the time the patient comes in. The other one is resource allocation, right? If you know a specific auth is going to be obtained, let's say 2 days from now, you don't have to spend that extra time in between checking in with the payer and chasing down that auth. So we move on to step 2, which is initiation. Initiation is really, as I said, figuring out who the right third-party administrator or the benefit manager is, who that payer, the home plan, has contracted out the prior authorization process to, and then initiate the prior auth request with them. There's questions here that AI can also help answer, which is, what type of requests need additional clinical documentations to prove medical necessity? And do we need to respond to a clinical pathway by a certain benefit manager, which is essentially a clinical survey that they ask based on certain types of procedures. This step is typically coupled with a verification step, which is different from insurance verification. This is focused on whether an auth has already been obtained by a different entity, for example. So we're verifying that there is a need for a new authorization request to be initiated. And if there is already an authorization on file, does that work, or do things need to change? And technology helps with this as well, more on the automation side than the AI side, but definitely a use case for technology here. What happens sometimes is, a rendering provider might want to initiate an authorization for a specific procedure, and they find out that the auth has already been initiated, but maybe from a different ordering provider or for a different rendering facility. These are some of the challenges that providers experience. And then lastly, once something is initiated, we go down the path of just the waiting game, right? Playing follow up with the payer, making sure they have all the information. Sometimes payers at this point in time come back and ask for additional clinical information, which increases your turnaround time, or they might want a peer review again, which can really drastically increase your turnaround time. And these are things that AI can predict and prevent, early on, just by looking at an order and looking at which payer and plan the auth is going to be required from. AI can potentially predict if enough clinical documentation is present to meet the guidelines, right? So, and if it is, it will let you know immediately. You can act on it proactively. You don't have to initiate a request with the payer, you wait on them for a day, and then just for them to come back and say, hey, we need additional clinical documents, or we need to talk to a physician or a nurse in your practice. All right, so having said that, let's concretely identify the AI use cases that I referenced in the last slide. Right, so we talked about how AI can help determine whether prior authorization is even required or not. The model that we built looks at a large set of parameters, not just procedure code and a payer, but it gets really deep into additional parameters such as the group, the plan, the geography, and other parameters to very accurately say if a prior authorization is required or not. Second thing is identifying clinical requirements for a procedure. We just concluded with this discussion on the previous slide about how knowing clinical requirements from an authorization point of view can be really helpful and impactful in saving you time and reducing that turnaround time of obtaining your authorization, and thus reducing costs associated with the additional time. Knowing clinical requirements will also prevent the risk of denials and peer reviews. So not only will the clinical requirement ability of AI help you bridge or shorten the turnaround time, but it will also be able to identify if there is a high risk of denial for a certain type of procedure, and then what is missing to prevent that denial. We spoke about turnaround time prediction and how that can help in scheduling patients in a more optimized fashion. AI can help identify gaps in documentation, all tying back to the clinical requirement use case. And the applications of this are immense and not just restricted to prior authorizations, but they can apply to your mid-revenue cycle use cases such as clinical documentation integrity and medical coding to make sure that the notes, the physician notes, the patient medical records have the backing, have the documentation for the codes that you're going to bill the payer and eventually get paid. And lastly, being more intelligently able to follow up for updates, as opposed to just following up constantly and not really having any direction as to when to follow up or not. Now, we've spent a lot of time talking about AI and machine learning use cases. We've addressed the concept of augmented intelligence, which is really creating these, there's an industry term I referenced to earlier called the digital supermind, is what they like to call it. But it really, it's not just a fancy word to me. I think it really applies in healthcare more than in any other industry, which is to get the maximum potential out of AI, you need human expertise, clinical expertise to work with it. But there's some other technology components here that, if you're looking for, best in breed prior authorization solution that you should be looking for. And those are integration, automation, and analytics. I'll start from the left-hand side. So integration is important because, if you're working with another vendor for prior authorization, one is you want to make sure that you don't have to duplicate any work, because then it's counterproductive in saving time and costs. You want to make sure that a vendor has the ability to integrate directly with your practice management system, EMR, or whatever system it is that you're using, so that as soon as, say, an order is created within your EMR, you don't have to do anything else. So that's the provider to vendor integration. Equally important, if not more important, is the payer integration. If you are looking to do this yourself, you need to make sure that you have the right payer integrations. Or if you're working with a vendor, you want to make sure that the vendor has connectivity to the payers. That is the whole crux of integration, because through a payer integration, basically a lot of the turnaround time with manual initiations and follow-ups can be reduced. And this is totally different from just any application of AI. This is just the benefits of having that integration. We speak about automation next, and integration allows for a certain form of automation. AI allows for a certain form of automation, whether it's direct payer integrations, whether it's AI determining or predicting whether something requires an authorization or not. But what we've noticed in the prior authorization space is that's not enough. There are still payer portals, payer websites out there that may not support direct integrations, or maybe it's hard to work with them to get that direct integration built. So there's alternate forms of automation that can be leveraged. At Infinix, we use something called robotic process automation, which can essentially mimic the tasks of a human when it comes to initiating a request on a web portal or a payer portal, and just avoiding, getting rid of tasks like that, so that your staff can then focus on more important functions, especially patient care. Analytics is important because you don't know what you're doing right until you have the raw numbers, or you have an output that shows you that you can invest a lot of time, a lot of effort, and capital into working with a vendor, doing integrations, creating an AI program. But if you don't have that insight, it can be very risky for you, right? So a prior authorization solution should always have the analytics capability to provide full transparency. At Infinix, we have a dedicated analytics module that gives you all the insights into all the functions performed by Infinix with your data. So how many transactions are coming in, you can slice and dice that by day, by weeks, by months, by years. What percentage of them are getting authorized versus what percentage did not require authorization? What is the turnaround time splits? and you can break them all up by payers. So if you want insights to see what payers are taking the highest turnaround times, or what payers are leading to peer review, and so on for what procedures, analytics can be very powerful in giving you that information. And I think this is our last slide, which is really summarizing everything that we've talked about into key measures of success, essentially the value proposition of this augmented intelligent approach to prior authorization that combines AI, automation techniques, integration capabilities, analytics, along with domain expertise. The first thing is faster turnaround times. All of these powerful components working together means eliminating a lot of those outliers, first of all, that just take too much time because maybe you don't have clinical documentations, or maybe the payers come back requesting a peer review. You're eliminating all of those, or a majority of those. You have clarity over when a payer is going to grant that prior authorization, so you don't have to constantly chase it, which ties into the second benefit here, which is the less human effort, in more ways than a few, right? Because the integration prevents you from having to enter information into a payer portal. The automation prevents you from constantly having to chase down and look at what information is available on the payer portal and then put it back into your EMR. As mentioned, at length earlier, the different ways in which AI helps reduce human efforts and reduce turnaround times. So all of these benefits are not only looking at operational efficiency and reducing human efforts, but also increasing accuracy, which then leads to reduced denials and a reduction in peer review, right? The AI and the automation capabilities, again, in more ways than one, reduce some of these human errors and thus lead to a higher rate of authorization. We mentioned how patient scheduling can be optimized, and thus, it would lead to reduced patient scheduling, and in turn, just higher patient satisfaction, which is, I know, an important metric for all of you here. I think that was it from me. I'm happy to answer questions.
Let's see. Does the system need to be integrated with an EMR?
Yeah, so does it need to be integrated? No, it doesn't need to be integrated. The solution that Infinix offers, it can be made available on a standalone web portal. So if you choose, you can come onto a web portal and type in your prior authorization requests, and the web portal will allow you to track it, view the statuses, and all of that good stuff. The value in integrating is, if you have high volumes of prior authorization requests, it prevents that duplicate effort in taking the patient demographics, physician information, procedures, ICDs, and having to type it in again into another portal. But it really depends on what you're looking out of your solution. The Infinix solution does offer integration capabilities with most EMRs.
Awesome. So then the next question we have is, how does it actually work? Is the program that runs alongside our current EMR, or is it something that can stand alone?
Yeah, great question, right? So it works in both ways, or one or another way. So if you choose to integrate with the solution, you can have a completely headless experience, is what we call it, which is you can keep working out of your system, not having to look at any payer portals or the Infinix solution. So all the information can be extracted from your EMR. So when a new order and appointment is created, patient demographics, ordering, rendering physician information, even priority statuses. I think Laura is responding to one of those questions right now, whether it's a stat case, same day case, and then the procedure CPD codes, ICD codes can be extracted directly from the order or appointment from your EMR. and we can send back updates into your EMR. You can see them if you have a field for it within your EMR. And once the authorization is obtained, I know there's fields for authorization number, effective date, expiration dates in most EMRs, so we can populate those fields within your EMR. But you will always have the option to come onto our portal if you wish, if there's anything else that you would like to check, if you want to filter, look at particular cases, or use our analytics module, you can always come to our portal.
Okay, and then another one I have is, does this work with all payers?
Yeah, so I really appreciate that question, because it brings out this concept of augmented intelligence, right? And I think it addresses it in a use case that people really care about, which is coverage across so many different types of payers, right? National payers, regional payers, local payers. So the different automation capabilities, whether it's direct payer integrations, those work with some of the national payers, some of the regional payers. But what we at Infinix do is, for some of these local payers or some of the payers that don't have the capability to integrate, we actually have our prior authorization specialists who can perform those manual functions, whether it is going onto a payer portal or even picking up the phone and calling the payer. And that's how we bring all these pieces together to make sure that, pretty much 100% of provider prior authorization requests are addressed.
Most payers have websites for pre-auth. How is this different?
Yeah, so most payers do have websites for pre-auth, but each payer has their own website. So the first biggest difference is you don't have to worry about going to 20 different websites, and not just the payer, right? Figuring out who the entity responsible for prior authorization is. So who is the third-party administrator or the benefit manager? And then from a payer point of view, you're tracking, let's say, X different payers' websites, and waiting for, initiating requests, waiting for follow-ups. So all the different use cases in which, we use AI and automation then help with reducing your time in those administrative processes.
Okay. And then I'm not sure if this got answered earlier or not, but I just wanted to put this out here. Would you manage stat or urgent authorization requests?
We do. We have the ability to deal with 3 different types of priorities. There's a standard priority, and then there's a same day, which is anywhere between 4 to 8 hours away. And then there's stat, which is anything within the next 4 hours. And we have, contractual commitments for initiation times for each one of those priorities.
That's all the questions I have now.
Awesome.
And I want to thank you so much for presenting today and giving that wonderful presentation. And then, of course, also answering all the questions we had today. We had some really great questions out there. And I definitely want to thank Infinix for sponsoring everything today. And we are very excited to be going to conference this year and just seeing everybody there. I want to thank all the attendees today for joining us, and everybody have a great rest of your day.
Great. Thanks, everyone.